Welcome to Innovate Training. My name is Carol Peugeot, and I'm your instructor for this course. This course is entitled Understanding HIPAA for the Medical Office, and this is Lesson 6, called Unique Health Identifiers. So what are we going to talk about today? Well, first we're going to identify the unique identifiers as defined by HIPAA. Then we're going to recognize which identifiers have been mandated, and then the status of other identifiers to date. And then we'll talk about the positive and negative implications of having a universal patient identification system. The Department of Health and Human Services has been authorized to develop unique identifiers for healthcare providers, for health plans, for employers, and for patients. So what is the purpose for these identifiers? Well, we've been using our Social Security numbers for many years now and understand how it identifies us as a unique individual. Well, just as our Social Security number identifies us, physicians also have assigned identifiers that identify the physician as well as the practice or the clinic. According to HIPAA's simplification, as part of the Administrative Simplification Act, the Department of Health and Human Services has greatly streamlined the transmission and processing of transactions. It eliminates possible confusion of identity. It eliminates confusion between employer and patient, and it helps to sort out the different parties involved in the claims processing. There are many opportunities in the process of billing insurance where the identity of the parties involved can get confusing, especially when it's between the patient and the insured, or especially when it's in between a managed care and an IPA, and then the financial carrier or the underwriter of an insurance policy. So these numbers will help to sort that out and identify the correct entity involved. Employer identifier. The Department of Health and Human Services defines the identifier for employers to be the Employer Identification Number, or EIN, provided by the Internal Revenue Service, or IRS. This may also be known as a tax ID number. It's a 9-digit code with a hyphen after the second digit, as demonstrated here. This appears on the IRS Form W-2 Wage and Tax Statement. A Healthcare Provider Identifier. This is also called the National Provider Identifier, or NPI, developed by the Centers for Medicare and Medicaid Services. This number replaces all other identifiers, including the UPIN number. This is a 10-digit number system with the last digit being a check digit, which provides a means to check that the number is correct by using an algorithm. Two types of NPI. There's an entity type, code 1, used for the individual physicians, and then there's an entity type code 2, which is designated for providers other than individuals such as clinics or supply organizations. In the past, it used to be very confusing which number to use as an identifier for a physician. It always depended on the type of insurance that you were billing. Some insurances wanted the tax ID number. Some insurances wanted the UPIN number, which is given by Medicare or Medicaid. Others wanted the physician's license number. Well, this NPI number has eliminated all that confusion, and now there's only one number that is dealt with as far as identifying the provider on the claim form. Each health plan will also have a unique identifier. The unique identifier is suggested to be the same one as the employer's EIN. The Department of Health and Human Services has yet to make a ruling on this one. A personal identifier. Several organizations have begun to develop a system to identify individuals. The challenge is to balance the need for identification with the need to protect the privacy of individuals. As of yet, there is no universal patient identifier, but there is discussion as to its benefits. One, it would improve the quality of health care due to a quick interchange between providers. And two, it would be one coordinated location for all health information, which would make it easier to coordinate health care and prescriptions. There is cause for concern, though, or reasons for concern. Concern against the personal identification include confidentiality and privacy intrusion, legal protection of the information, the cost associated with moving to a new identifier, issues dealing with implementation of patient records, ease of theft, ease of access into private health information. It's always concerning when you think about one entity or one particular governmental entity would have too much access or too much control into a person's private life. In this case, it would be too easy for the government or even a healthcare provider to be able to access the patient's information. To think about applying for insurance, how easy it would be for the insurance carrier to be able to look into the patient's medical records and be able to find a reason to either discontinue or to provide a reason to deny based on a pre-existing condition. So those are some concerns that are being talked about. Well, in summary, unique identifier is not a new concept. We've been using our Social Security numbers, bank and account numbers, as well as many other identification numbers. Unique identifiers for physicians, health plans, and employers help to streamline the healthcare claims processing. Personal identifiers is an idea that offers benefits as well as some real concerns regarding the patient's rights to privacy. Well, I hope you enjoyed this lecture. This has been called Unique Health Identifiers. This is HIPAA, Understanding HIPAA for the Medical Office. My name is Carol Peugeot. I am your instructor from Innovate Training. Please be sure to contact me with any questions or comments, and please be sure to take the assessment quiz at the end of this lecture, as these questions will be helpful for you for the final exam. So this is Carol Peugeot. Until next time, we'll see you.